Yeah, so, I think my big takeaway is that we have incredibly potent results in terms of this drug with an incredibly good safety profile as well. So an easy number to walk away with is that there was, almost 90% of patients made PASI 90 at 24 weeks. So we didn't even show PASI 75 data. We started with the PASI 90 data. It was 86.6% of patients at 24 weeks. It was 70.5% at the earlier time point of 16 weeks. Very low placebo response rate at 16 weeks, but then they rolled over, and then in that even 8-week time period, 50% of those patients made it to PASI 90. Another outcome, similar outcome is clear or almost clear, the IGA of 0 to 1. It was 84.1% at the 16 week, and at 24 weeks, 86.4%, with the placebo right close by in that 8-week time period, bringing it to 81.8%. So, almost PASI 9, almost 90% PASI 90 in the time period, with 86 plus percent making it to IGA of 0, 1. And then the next, the even more penetrative responses is looking at an IGA of 0. And it was 75% of patients who made it to an IGA of 0 at week 24. And a correlate PASI 100 is 63.6%. So, incredibly high capture rate of patients making it to at least 90% or better PASI improvement, with a very high rate of those who made it to clear as well. Certainly efficacy that stands up with any psoriasis therapy as an oral agent. It's just a whole new world of efficacy. Lastly, shouldn't have to mention the safety as well, and the data set is very consistent, the overall study population data set as well, which is not a lot of remarkable adverse events. There happened to be two serious adverse events in the adolescent group, but neither of them were considered secondary to the drug. One patient temporarily stopped drug and went right back on it. Another one had been hospitalized for an evaluation, but was not related to drug and never stopped drug. Um, um, Otherwise unremarkable side effect profile, a little bit of upper respiratory infection, nasopharyngitis. Very importantly, very, very low GI side effects. This is an orally given drug, generally on an empty stomach, but it was really did incredibly well. And the laboratory abnormalities were similar between those who got the ICO and those who were in placebo. So a very good safety profile as well. And so I'll take big picture and then come back to psoriasis. The big picture is like, wow, this technology has set up essentially injectable biologic-like efficacy in an oral agent. And certainly for adolescent psoriasis with this particular drug and this particular peptide, I think having the ability to get such rapid effectiveness with a great safety profile without the need for injectables and without the need for, you know, following, concerns about blood work concerns. And it's really gonna be, incredibly well received by the, dermatology community. So, very impressive results, in terms of how the patients did over those both the 16 and 24-week outcome measures. So, I think it's really a exciting addition to our armamentarium for psoriasis as this drug goes through and hopefully gets approved in the future.